Huh.
Yeah, edited at the beginning. So. All right, so Dr. Dail, my good friend and colleague and business partner. I'm just so happy to work with you and practice with you. We've been in practice together for 10 years now.
Yes.
Isn't that amazing?
Seems like yesterday.
Yeah, it really does. Time goes by when you're having fun, and we do have fun here.
Yes.
So one of the things that brings you joy in your practice life, your professional life, is working with babies in chiropractic care.
Oh, by far, my favorite.
Why?
By far. It's such an honor. You know, the parents trust you with their baby, and babies respond so quickly. It's miracles. You see miracles.
Cool. What are some of the
So
conditions that parents are concerned about that they would want their kids checked?
Colic is probably the number one. The baby's just not sleeping. The parents are not sleeping as well. Baby's crying all the time, miserable, which makes the parents miserable. But it's so great. The parents come back, thank you, God bless you, I have a new baby.
Nice. Nice.
So yeah, it's very rewarding. And that's by far my favorite part of my job.
Now, when they say they have a new baby, they haven't traded the baby
No,
in.
they haven't
The
traded
baby's
it.
much better, healthier.
But yeah,
So what is
it's
a
like a different baby.
What is a pediatric adjustment like? Is it like a major twist and crunch?
I remember in school they said to tell people it's about the amount of pressure you can put on your eyeball. So very light touch.
Gotcha. How about the examination? What do you do to examine the baby?
To examine the baby, I just feel which vertebrae are not moving like they should with my hands.
Do you usually hold the baby, or do you have the parent hold the baby?
You know, it can go either way. I hold the baby sometimes. Sometimes I lay the baby on the mother or father's stomach and adjust them like that. Sometimes I have them hold them. So it depends on each child.
Yeah, how comfortable they are
Yeah,
with you.
exactly.
That's the way I kind of work with it too. So that's great. Now, how do you? Parents probably don't show up at the chiropractor's office saying, "I want my baby adjusted." How do you get that idea across that that's appropriate for a parent?
Yeah, and that's a hard one for a lot of people to swallow. It scares them because they think crunching, twisting and crunching. Usually have a patient that's a mother or father, and they'll complain about lack of sleep. And I ask them what's wrong. Babies, have you ever thought about it? And then I show them just how much pressure. The adjustment is very gentle because they don't think that. They think it's going to be a dangerous operation for their baby, a dangerous procedure. But I assure them, and they at that point usually they're desperate because they haven't had sleep in days. So.
Right. Oh, that's great. I know I've seen parents come in with a baby and they're concerned, and they walk out and everybody's smiling.
Yes. That's why I love it.
I know I found that after an adjustment, parents will come back and they'll say, "My baby slept for an hour after the adjustment." Have you seen that happen?
Yeah, babies, a lot of times they poop.
Yeah.
That's a common one.
Yeah.
And when they have it, constipation is a lot of why they're hurting. They sleep better. They're hungrier. Everything's better.
Yeah.
Everything.
It's an awesome honor, isn't it?
Yeah, it is.
That's great. Well, again, it's good working with you. I'm looking forward to the next 10
10
years.
years,
Amen.
yes. We laugh every day. Every day for 10 years. We crack up. What a blessing. What a
Yes,
blessing.
it is. It is a good thing. Thanks, Doc.
Yes.
Huh.